Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752. Right here in the studio, that's 866-870-5752. Check out the website at www.lastemcells.com. You can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. We're here Saturdays at 10 and again at 1 p.m. And when you phone the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, Regenerate, Don't Operate, with 264 scientific studies. What do you think?
I love it. So, Brian, are you still with us?
Yes.
Good, good. I'm going to get to you in 1 second. I just want to give a little intro to the second half hour of the show. So, my name is Marc Darrow. I'm a medical doctor. I trained at UCLA in my residency, and I've been doing regenerative medicine of platelets from your blood and bone marrow, which has platelets and the nice ingredient of stem cells, which is a real buzzword today, plus a lot of other things, exosomes and cytokines and growth factors. So it's been a practice that has really given me an amazing life. Before we had platelets and stem cells, we used other proliferants to grow tissue. And I've been doing this since my residency. I graduated in 98 from that, and I started doing it during my residency to everyone's chagrin. They're like, what are you doing? And I said, it's something that worked on me. I want to try it on everybody else. So, I work on the musculoskeletal system, meaning all the way from the head all the way down to the bottom of the feet and everything in between, necks, backs, arthritis, fingers, toes, ankles, knees, hips, shoulders, elbows. I've worked on my own. When I say I worked on my own, I've actually injected my own wrist, both of my shoulders, both of my knees. What else? I had some broken ribs that we did this on. I've had other people do my neck and my back because I can't reach back there, and I'm not going to do it in a mirror. So it's something I've used with amazing success on my own body for over 20 years. And I get about 60 to 80 new patients a month that I work on. And for the most part, it's been amazing. Brian asked me, well, why doesn't it work on everybody? And the answers I started to talk about, but I'm going to repeat it for you guys who just tuned in. When people stay active on that area, whatever it is, they're not going to feel the healing. There is healing going on because we know that tissue grows. Biopsies have been done in studies to see brand new granulation tissue. And then I've seen it in areas like knees and hips where there's what we call bone on bone. And then after the injections, we can actually see the joint space open up and new cartilage grow. So we know it's for real. It's not just a placebo. So number one is activity levels can make people feel like they're not getting better if they don't stop doing what caused the problem in the beginning. So the second reason is people take things like ibuprofen, non-steroidal anti-inflammatories, which blocks the inflammation. It helps their pain, but it's blocking their inflammation, which is needed to bring fibroblasts to the area that grow back the tissue. So that's number two. And then number three, some people quit. They end up going to a different doctor who says, that's Boulder Dash. You can't grow tissue. That doesn't work. Really? Does that guy do this for a living? Well, no. And then the orthopedic surgeons who do it typically would do it one time, and then when it doesn't work in one time, they go, now it's time for surgery. That stuff didn't work on you. None of that's true. Sometimes you need several treatments. It's like when someone looks at a hole in the ground, how many shovelfuls of dirt is it going to take to fill it up? I don't have the answer. Sometimes one and sometimes several. So that's not a great answer, but that's the truth. Number 4, some doctors who do this do not know what they were doing, and that's most doctors. If you go to someone who doesn't do this for a living, who doesn't do it all day long, you're making a mistake. It's like going to a surgeon that operates once a week or once a month. That's not the guy you want to go to. Anytime I refer someone to a doctor for anything, I don't care if it's kidney disease or cardiac issues or whatever it is, I only send them to someone that I know does that work all day long. Now, are you going to go to a chiropractor to get stem cells? I don't think so. But that's what happens to a lot of my patients. They come in after they've been to a chiropractor who hired some nurse or some doctor who doesn't have a clue what they're doing and then say it didn't work. So like anything else, you want to go to a doctor who does the most. If you want a house built, are you going to go to a carpenter that's never built a house before? I hope not. Same thing with doctors. Regenerative medicine's been a great thing for a lot of people and a terrible thing for a lot of people who go to doctors who don't know what they're doing. Don't go to a chiropractor for regenerative medicine. Chiropractors are amazing at their body work that they do. I love chiropractors. I had a partner for 10 years who was a chiropractor. He was amazing. He was a great healer. But be careful. Don't get sucked into going to some dinner where it's a free dinner and they present stem cells to your PRP, platelet-rich plasma, and then you ask them, are you the guy doing this? No. Who's going to do it? Well, we don't even know yet. We're going to get someone to come in. Those people don't know what they're doing, so be careful. And they charge a frickin' fortune to do that stuff. I don't know what they're doing. So be careful. Anyway, Brian, does that answer some of your questions about it?
Yes.
Oh, there's one other thing. Number 5, make sure that they used an ultrasound. Did they inject your knee with an ultrasound?
This one did.
That's good. That's a good start.
Okay, my other question, you said stay off of it. When you did it yourself on your shoulder, how long did you stay off your shoulder before you went back to the activity you like to do?
I don't remember. That's a good question. I don't remember. I mean, I haven't injected myself for a while.
No, I know you like playing golf and tennis and stuff. That's why I used to like playing basketball, but I gave that up. And
it's different. Golf. It's different. It's going to be different for you and me anyway, Brian. And I'll tell you why. If I inject myself today and I go out and do a sport today, I can go back and inject myself tomorrow. Do you understand that?
That's true, because you have the means to do that right now.
Yeah, it's right in my office. I can inject myself anytime I want. I mean, I'll give you an example. I hurt my knee during when COVID first started because we had to push a cart. We weren't allowed to drive in a cart. We had to walk. And I had a cart, and I play up at Mountain Gate, which has very thick kukua grass, and it's in the mountains. So I was pushing this cart through this thick grass up the hills. And my knee went out. Also, I run a lot. So my knee went out. I didn't care. I kept going. It hurt. I didn't care. I kept going. I kept playing golf. I kept running. And then I played golf one Sunday afternoon, and by the 9th hole, I could not walk. I limped off the course. I drove down to my office, which is in West LA, across the freeway from UCLA. And I looked with the ultrasound, and I saw an enormous amount of fluid in my knee. And inside my head, I was saying some pretty nasty words. And I then aspirated out about 40 or so cc's, 45 cc's of fluid. That's a lot, okay? And then I injected myself with stem cells, and I did it 4 times in 1 week. You wouldn't want to do that, most likely. My knee is perfect now. I looked with the ultrasound. It's dry. I had a meniscal tear, a medial meniscal tear. That meniscus was torn up. I don't even see that on ultrasound anymore. and I'm able to go back and do whatever I want. So you can't categorize, other people with me. All right. Now I do have people who do several treatments in 1 week, guys who really want to get better fast, but it's not typical. Okay. And as far as I'm concerned, the more frequently you treat, the faster you're going to heal. There's a lot of guys that'll say, okay, we just did stem cells or platelets, come back in 3 months, come back in 6 months, we'll see how you do. I don't think that's a great approach. That's just my opinion. My opinion is get it done now, because you're going to cheat on me. Cheating on me means you're going to go out and get active. So you even asked the question, how soon after I injected my shoulder did I get active again and do sports? That to me means you want to know how fast you can get back to sports or be active. There's no answer. Everybody's different. I generally have people come back after 2 weeks after a treatment, see how they're doing, and if they want to treat again. If they didn't get what they wanted, then I'll treat them again. Okay? Does that make sense?
That perfect sense. Thank you very much.
Brian, God bless you, man. I really appreciate your call.
God bless you too.
You've had a lot of things that we're able to talk about just because of your own knee. And I don't know what to tell you about your knee. I mean, if you want me to examine it, I'd be so happy to do that. And the number to the office, again, for those listening, is 800-300-9300, 800-300-9300. Brian, I can typically tell someone after I examine them in about 1 minute what the story will be for them. Okay? Oh, by the way, we started off the show about a young woman who came in yesterday who had had 2 failed neck surgeries, and I touched her neck, and it took me about 2 seconds to say, I can probably help her. Okay?
I got it. Thank you.
Thanks, Brian.
And I said that's not a promise, and I guarantee nothing. But what she had, in my simple-mindedness, is ligament issues, a sprain of her neck. Just like a sprained ankle in the neck. People don't get surgeries on sprained ankles. Why are you going to get surgery on a sprained neck or back or joint? Makes no sense to me, but that's life.
Well, that's a byline of the show. Take the surgery out of pain. Right?
Yeah. So I'm going to ask for callers. I'd love to talk to some more people. Thank you, Brian, for calling in. The phone number to reach me right now, ask your questions, is 866-870-5752. It's 866-870-5752. Nita, do you remember the show Inner Sanctum when you were a little girl? It was the scary show, and it sounded like a squeaky chair like yours, like...
No, I don't remember. However...
It used to scare me so much just to hear the end when the TV show began.
I don't remember that at all.
Maybe you were a little bit younger than me.
Yeah, maybe I wasn't born yet. Hello?
Oh, you must have been a cute little baby.
Oh, yeah. I'll send you pictures sometimes. I was.
Please.
They said when I was quiet, I was at my best. Go ahead.
So, Nita, why does a chicken coop only have 2 doors? Because if it had 4 doors, it would be called a chicken sedan.
Oh, my gosh. I'm a car girl. I should have known that one, really.
Yeah, you should have. Have you ever heard about the corduroy pillow? Have I ever told this one before?
No,
I think I might have.
This one I don't recall.
Yeah, it's corduroy pillow. It's making headlines.
Boy, I hope we get a caller soon. I'm being tortured here, guys. Come on. 866-870-5752. 866
Save Nita.
870-5752. Oh, my gosh.
Now it worked. The callers are coming in. I see them. Hey, lady.
Okay.
You have musculoskeletal issues. How are you today, lady?
Hi. I'm fine. I'm fine.
We can't hear you.
Calling.
Hey, lady, scream at me. I can't hear you. Are you on your speakerphone?
I'm sorry.
Talk loud.
I'm sorry.
Talk loud.
Talk louder. Talk louder. Really?
Really?
Yeah, scream.
Oh, okay. I am calling not for myself, but I'm concerned about a very good friend who has MSA, and
Wait, I didn't hear what you said. Has what?
Okay. He has SMA.
XMA.
I thought you said MSA.
No, a skeletal muscular atrophy.
Ah, that's a neurological disease. I can't help him unless he has a joint that he's overused because of his weakness. Like, let's say he's in a wheelchair and is using his arms a lot and his shoulder hurts. I can help that, but the disease itself is something that I can do nothing about. Okay?
Because that's a loss of protein?
I'm sorry?
Is that a loss of protein?
I'm not going to get into that because it's not what I do. You have to talk to a neurologist about that. Does he have any pain? That. Yeah, does he have pain? UCLA has a great... The joint pain I can help him with, yeah. Yeah, that I can help with.
Okay. So that would be stem cells as well?
I don't know I don't tell anyone what I'm going to do until I examine them. And then we talk about what the best thing for them is. I don't tell anyone. I never tell anyone what to do. A lot of new patients come and they go, "Come on, tell me what to do. You're my doctor." I go, "No, I'm not going to tell you what to do. I'll educate you and ask all your questions for as long as you like. And then you can email me later and text me later or call me. I give everybody my cell number. And then you decide what you think is best. I'll help you decide, but I don't tell people what to do. You know why?
Uh-huh.
I don't want them pointing their fingers at me later and saying, "You told me so." Yeah,
right.
I don't like that.
Right.
But yeah, if your friend with spinal muscular atrophy, which is a neurological condition, has joint pain, typically I can help with that. I don't promise anybody anything, and I definitely have to examine him first or her first to see what's going on, where it is, and then talk to them about it. Now, like I said, UCLA has an amazing department for those type of diseases, and that's where I would go to find out about it. UCLA is amazing, yeah.
Oh,
that's where I used to work. Yeah.
Would you happen to have that number for the neurology, or I just call in UCLA main number and get it?
Well, I mean, I could look it up on Google for you.
I can. Okay, if that's I can do that. I can do that.
Yeah, you can do that. UCLA Neurology Department. You ready? It's 310 825 0703. Yeah, 310 825 0703. UCLA Neurology Department. They're in Westwood, on Westwood Plaza. Okay?
Okay. Thank you so very much. God bless you all.
God bless you, and
Thank
God
you.
bless your friend.
You
That's
too.
a tough one.
Yeah.
That's a tough one.
Thank you.
Thank you so much. Our number is 866-870-5752. That's 866-870-5752. Right here in the studio. You got a few minutes left to call Dr. Darrow and speak directly to him about your chronic musculoskeletal pain issue.
And if you call me right now at 866-870-5752, I will send you a copy of my book on stem cells and platelets. It's called Regenerate, Don't Operate. And it's got quite a bit of great information here, tons and tons of studies on why you may not want to do surgery and you may want to learn about regenerative medicine. And I'll even give you another book for free to give to your doctor to educate him, because most doctors are behind the times. Every doctor that I know is afraid of doing regenerative medicine because they think they won't get referrals because it's not considered traditional. Well, I think it's traditional. It's been around since, we know about it since 5000 BC, where the Chinese were doing it with heated needles, and then we know Hippocrates, the father of Western medicine, was doing it. He had the Olympians or he would scald the axilla, which is the armpit, for people that had shoulder dislocations to tighten up the joint. Now we do it with skinny little needles and inject platelets and stem cells. A lot easier to do than getting burned, I'll tell you that.
Oh, gosh, yeah. Should we go to Mike?
Yeah, Mike, Dr. Marc Darrow, how are you today?
Hey, doctor, I always saw your TV commercials on that back stretching machine. It was kind of interesting. But
oh, my God, that was years ago, yeah.
Yeah, I know, and they still run them. Hey, so anyway, my buddy is a famous attorney in town, and he's now kind of getting pushed. He loves to play tennis. He's probably 75, loves to play tennis.
Yeah.
And what happened is now they're telling him he needs shoulder surgery, and it's the only thing. And I hope he's listening, because I just told him to call, to listen to this show. And
well, you can tell him that you can tell him that I'm not a famous attorney. I'm an infamous attorney. So we can talk the same language.
Right. You're an attorney, right?
Yeah, I'm going to tell you a real quick story, because we've got a bunch of people like usual at the end of the show that want to talk. So when I called the dean of admissions for medical school, I told him I was a lawyer, and he said, "Son, I want you to come to medical school." He invited me. I didn't even apply. He goes, "I'm going to save your soul." Those were his words. Anyway,
well,
so
my
yeah,
buddy's shoulder because he's listening.
Well,
sure he's listening.
I think so. I think so. If he's willing to
what's the
do what
deal,
needs
though?
to get
Why
done.
are they pushing surgery? Because he's telling me all these doctors are telling him stem cells not proven. It's not going to work.
Oh,
It
that's
depends
such
who's
nonsense.
doing the stem cell, right?
Such nonsense. Yeah. It depends who's doing it, but the point is, if you're an orthopedic surgeon, it doesn't work. That's it. That's the end of the story. Okay? Need I say more?
So an orthopedic surgeon will always tell you it's surgery.
I'm not saying always anything, but that is the culture. That's the religion. Okay? It's hard to step out of the culture or the religion of orthopedic surgery. I'm in a different religion,
tell my
a different
buddy
culture.
what stem cell. Just real quick, I know you said these things before with shoulder. Just mention what it is, just in 30 seconds or so. What's the difference between surgery and stem cell?
Surgery uses a knife to cut open the body and cause damage. Okay? A surgeon won't say that, but I'm going to, because I get all the people that have gone to a surgeon, had a surgery, and end up worse. So I don't like it. I'm sorry. That's my own opinion. I'm entitled to it. I had a surgery on my shoulder in medical school by my boss. I don't blame him for the bad result. It just didn't come out good. That's what pushed me to learn about what I'm doing today, what I've done my entire medical career. What we do is we take stem cells from the body. We use the bone marrow, and it takes me typically about 15 seconds to do the procedure after it's numb. Every once in a while it'll take longer if we run into an issue, but the typical patient is about 15 seconds to do the whole procedure. We then take those cells and inject them with a needle. We don't cut anything open. We do a few pokes. I use an ultrasound to guide the needle, and then that's it. They walk out. What else you want to know, Mike?
That's about as simple. I mean, I'd love to know the price, but I'm sure you can't say on. Is it under $1,000 for this kind of thing, or are you free to say?
Again, we don't talk about that because everybody's different in what we're doing. So to do that, call the office, Mike. You can call the office. It's 800-300-9300, 800-300-9300. You can call there and give more details, and they're going to probably tell you the same thing. Your buddy's got to come in. I've got to examine him, talk to him, and see what's up. Anyway, God bless everybody. We're going to the end of the show here.
We
are. If you want to get to the office, the phone number is 800-300-9300. And if you want to watch me do procedures on videos, go to the website, www.lastemcells.com. I love you all. Thank you, Nita and staff, Alex, Suzette.
And
we'll
thank
talk to you soon.
We'll see you next time.
You've been listening to Living Pain-Free with Dr. Marc Darrow. Now that you've heard Dr. Darrow, you can schedule an appointment to talk with him in person by calling his office anytime at 800-300-9300. That's 800-300-9300. Or go online to lastemcells.com. Again, the website is lastemcells.com. Living Pain-Free with Dr. Marc Darrow is heard every Saturday at 10 a.m. and 1 p.m. here on AM 870 The Answer. Remember, to take the first step toward a pain-free life, schedule an appointment by calling 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.